Hey, I'm Di McQueen, licensed clinical social worker, family and addiction expert. I'm here with Dr. Brian Jackson, my longtime cohort who specializes in the field of addiction. Welcome to Healing Families Shattered by Addiction.
Di and I have worked with addicts, alcoholics, and their families for over 30 years combined. Our podcast and coaching programs focus on families who have a loved one suffering from addiction. Our experience has been that this disease affects families as much, if not more, than the addict or alcoholic.
Is your world spinning out of control? Are you codependent? Are you experiencing worry, loss of sleep, and difficulty concentrating? If so, you're in the right place. Brian and I have both personally lived it, learned it, and now we're going to teach you tools and techniques on how to get your life back that you thought was shattered by addiction.
Okay, let's dive in.
Brian and I are so excited to introduce to you our new sponsor, Lakeview Health. They are a wonderful residential treatment center. Whether it's the family member who is looking for a place or the addict or alcoholic themselves, this would be the place that we would refer them to. Brian, you have many years of experience with Lakeview.
Yeah, Lakeview Health is a center of excellent addiction treatment. They take an evidence-based approach, medical approach to treating this complex brain disease. They hold the Joint Commission's Golden Seal, and they were voted one of America's best treatment centers by Newsweek magazine. They deliver dual diagnosis, gender-responsive, and trauma-informed care at their gorgeous facility here in Jacksonville, Florida. But they do see people from all over the world do come here to Jacksonville to go to treatment at Lakeview. Their levels of care include medically supervised detox, which a lot of people do need. Then they stabilize them in a residential rehabilitation and partial hospitalization program. They have board-certified physicians, master-level therapists, and they work to address the unique needs of each patient. So in other words, it's not a cookie-cutter program. They help individuals build skills for long-term sobriety. So if you or someone you know needs treatment, please visit their site at lakeviewhealth.com. We also have a hyperlink on our website at familyandaddictionexperts.com where you can just click and get some information about Lakeview Health. And Di, I think you have a number for people to call if they would like to inquire about treatment.
I sure do. That number is 888-480-3799. That's 888-480-3799. Give them a call. Hey everybody, this is Di McQueen, and I'm here with the latest segment of Healing Families Shattered by Addiction. Welcome back. Really appreciate you guys. Today I thought I'd just do a very quick little segment for you on what is substance abuse. I'm just going to define it, sort of talk about symptoms of, and that's really it for today, just so you can kind of understand what does it look like. You know, what do people mean when they say that? So basically, when we hear about, alcohol and drug dependence, we call that a substance use disorder. It's complex. It's not just a really simple thought process that most people go like, what exactly is this? Used to be that people thought that someone that had this disorder or an addiction of some kind was morally weak, and that they had some sort of character defect. Brian and I are not of the mindset. There's been a ton of research and, studies done for years and years and years that most scientists and medical researchers consider it to be a long-term illness, very similar to something like diabetes, asthma, hypertension, that type of thing. So, most people who drink, a little alcohol and can stop without struggling, don't have to really worry about it. But however, in time, some people actually do develop a substance use disorder. And it is something that is compulsive and can become very dangerous. So why is it that some people get it and other people don't? So when you think about this substance use disorder, it affects, there is no line. There's no like one thing that says, hey, you're going to get this one. It doesn't necessarily care that you are rich, that you are poor, that you are employed, that you are unemployed, that you're a female, male, and, your race, your ethnicity, all that stuff. It doesn't really care. It decides what it's going to do. And nobody to this date is 100% sure why or what causes it. We do know that there is, in fact, a genetic linkage to a significant number of those who have, substance use disorder. But that's not always the case as well. Sometimes this genetic linkage is passed down through family members, specifically when it comes to alcohol. On the male side, the paternal side of that family has addiction or substance use in it. There's an 8 times greater chance that if there is a male in the family line, that they are predisposed to it. That doesn't, again, necessarily mean that they're going to get it. It does mean that they have a higher percentage chance. So, much like many other genetic linkages we have, people can get these things, right? And we have predisposition to, right? So that may be part of the cause. A person's environment, their psychological traits, their stress levels, that plays into a lot of what goes on in in someone maybe potentially getting a substance use disorder. In time, research has shown that using drugs for long periods changes the brain, which is extremely important to understand, in long lasting ways, sometimes permanently, not always, right? Depends again on the person, how long, what's been going on. But once this switch has been turned on in the brain, it becomes different for every person when that switch clicks and if it will. So unfortunately, when it does turn on, the person crosses that invisible line of being able to control or stop, and they become dependent on this substance. And, that usually means from a physical standpoint. So, once you have, family lineage and things that have the ability to do that, you have a higher chance, but that doesn't mean you will. Once the brain changes and remains, in effect long after, even if you get sober, that's there and it is progressive. So, what are the symptoms, right, of a substance use disorder? One of the most important signs of substance addiction or dependency is the continued use of drugs or alcohol, despite the fact that you can experience a negative consequence. So when things are, you lose your family, you lose, your job, whatever, and you continue to use anyway. Often the person blames other circumstances and people for the reasons why they do this, instead of realizing that there's some difficulty resulting from something that they're doing themselves. So, of course, it'd be something like the fact that they got fired from their job, but it's the boss's fault because he's a jerk. And it doesn't matter that I haven't shown up for work for the last 3 weeks and he's given me several warnings, but, that's the kind of thing that goes on. And we get into a place in our mindset that we call, denial, right? That's a primary defense mechanism. And a lot of people need to do that to protect themselves. And our disease does that as well. And I do say our disease because it talks to them and to, people, and kind of have, this misnomer that everybody else in the world's doing things wrong, but this thing is protecting it in some fashion. So there's a few criteria that happen to be when someone has a substance use disorder. Tolerance, a person's need for an increasingly larger amount of alcohol or drugs to get the same effect. A craving, a person will have a strong need or desire or urge to use drugs or alcohol despite the negative consequence. And they will feel anxious and irritable if they can't get this, right? Craving is a primary symptom of addiction that you just, like you can't get it out of your head. You got to do it, and it's not just for, drugs and alcohol, food, gambling, etc. The addiction is the addiction. Loss of control. This is a big one, right? A person often will drink more alcohol or take more drugs than he or she ever meant to. They may in time, try to like stop and give themselves limits on what they're going to do, what they're not going to do, reduce the amount that they were going to do, and they're just not able to maintain this and they fail over and over again. That's usually a pretty good indication that someone has a problem. And of course, lastly, they have the physical dependence that has withdrawal symptoms. So in other words, if you go on a binge or whatever with alcohol, drugs, when you stop, you have terrible withdrawal symptoms, which is that physical need, right? And without it, you get nauseous, sweating, sick, shaky. Maybe your blood pressure goes through the moon. You could actually stroke, or have other symptoms that can be quite dangerous, especially as it relates to alcohol or benzodiazepines. But these are the things that I just wanted to educate you on a little bit. And if you see that within the people that you love and care about, it may be something that needs to be discussed. Maybe you need to send them to a professional for an evaluation, or ask them about, can we try to do this a different way? Would you be willing? Um, and from there's lots of other things that we can do. It's very important that people get treatment of some kind if they're willing. If they're not, it's very important that you learn tools and techniques on how to help them, on how to help yourself first and foremost. So that was my little 5-minute rundown on what is substance use disorder. Thanks so much. Really appreciate you guys listening. And again, this is Healing Families Shattered by Addiction. We're here for you. Give us a call, send us an email. We are at info@familyandaddictions.com. And we are, like I said, there's some resources on there that would be really helpful for you guys, just to get some education and understand that you are not alone in this journey. As a family member or someone who cares about someone who has this disorder, it's very, very important that you also get some tools and techniques in your belt and be able to figure out what to do to help. If not them, you. All right. Thanks again. Thanks so much for joining our podcast, Healing Families Shattered by Addiction. We'll be back in a couple of weeks with more important tools, techniques, and ways for you to focus on you instead of the alcoholic or addict in your world.
Until then, please go to our website, familyandaddictionexperts.com. That's familyandaddictionexperts.com. You'll also see links to our Facebook and Instagram pages. Please also, if you have any emails that you would like to send us, that's info@familyandaddictionexperts.com. That's info@familyandaddictionexperts.com. With any thoughts, feelings, questions that you may have for us, we would love to hear from you, and we look forward to seeing you in a couple of weeks.